Okay. Now, when we talk of the vaccinations, we have two types of vaccinations. We have the chemical and the remedies, oba herbal. Now, when we talk of the chemical vaccinations, 1 day old, there is Malex, Newcastle, IB1, and Gombolo. From our office or our company or our organization, all the chicks we deliver or we supply are vaccinated against these 4 diseases at day 1. Kino nze njagala mbagambe whoever is viewing, when you are dealing in chicken, please make sure all the chicks hatched in your hatchery must be vaccinated at day 1, regardless of what breed. Ekyo njagala tukimanye nakyo. Malex, this is the HIV of chicken. Ekyo njagala tukimanye. This is a hatchery-borne disease. It is a combination of various viruses. That's why there is no chemical medicine which cures Malex. It has to be vaccinated at day 1. And if somebody tells you that revaccinate Malex at your farm or your mufu, it is wrong. It is not that every farmer have the knowledge and the capacity of vaccinating Malex. It is an injectable. Newcastle, this is the #1 killer disease of all types of chicken breeds. This IB, it also kills. Gombolo, it attacks in 2 weeks. So with this here, 1 day old chick, as Universal Farm Care Solutions, what we do, we vaccinate them at day 1. All the types of breeds. Enkoko zonna tuzigema nga za lunaku lumu. In a combination of these, there is no farm apart from kwagala. Eyo njitegeera bulungi, and I know it. Then Lobuko, njimanyi bulungi, njitegeera bulungi. The reason why I'm talking about these ones, we work hand in hand. But the rest, zemulaba ku social media okwo, these are fake. Babalimba. This is the reason why somebody tells you that in 10 days, make sure you revaccinate. Teriyo mulimi mulunzi ali mu kyalo asobola kugema Malex. Teri. Have no capacity. The measurement of this dosage, to be honest. But the checks you receive from Universal Farm Care Solutions, day 1 are vaccinated against these. We combine them. Lwaki mbagamba ekintu kino? We have some people abalemala nga bw'omugamba nti we use the herbal medicine to vaccinate, doesn't accept and believe, forgetting that even the chemical medicine are made from plants. Ekyo abantu obwongo kye mutayina. There is no medicine which comes from heaven all comes from the ground, from the grass and the plants. Just a matter of value addition. And they bring back to us. And you buy them. With the complications.
Viewers of Living Agriculture, this is luigareThe. I welcome you to this channel of Living Agriculture, where you get the knowledge, the skill, and the technical system. Today, I cordially invite whoever is viewing, even if you are not in the country and you have some people left behind, please, we are organizing a workshop at the farm. And this workshop is scheduled to take place on 8th of June 2024. We are meeting at our offices in the New Tax Park. That's where we shall live as a team or as a group to the farm. The entrance is 50,000. But if you are a living viewer or a subscriber or our family, you will need to pay just 30. 20 is paid by Living Agriculture. Whatever you have been viewing, hatching eggs in a motor tire, hatching in a pot, how do we mix the feeds practically? How do we put charcoal in the feeds? What quantity? How do we make the medicine for toothache, for ulcers, for prostate, for diabetes and pressure? We are going to show everything on that day. I thank you for viewing, but whoever is viewing, share this video. On 8th of June, it is our farm training. We are meeting in the New Tax Park at our offices. That's where we shall depart. The farm is located in Seguku, Katare. This is where we have all our enterprises. I welcome you there, but the registration have to register with Hannah on 0775 107737. Registration 0775 107737. An Airtel subscriber, it is 0741 82 84 05. I repeat, for registration for the workshop, 0741 82 84 05. Make sure that if at all you have one of the diseases I mentioned, on your registration include the treatment you want. Is it diabetes? Is it pressure? Is it prostate? Is it toothache? Or what? Or ulcers? Such that it enables us to come with a medicine. We need treated people. We need live people, such that we can go in farming when we are alive. I'm luigareThe. On 8th of June, it is our farm training at Seguku. The entrance is 50, but for Living Agriculture family, you are going to pay only 30. 20 have been sponsored by Living Agriculture. I thank you for viewing. I thank you for liking. We meet on that day.
Every chemical medicine has its complication, of which you need to understand. Day one, this is what we vaccinate. It is injectable before delivery. I remind you, when you get these chicks and you are given a vaccination program that you need to revaccinate, make sure that person vaccinates for you, because you don't have that capacity and the knowledge of vaccinating them. Ekyo kye kisinze okulemesa abantu. Kati gwandaba oyina magezi ki to administer this vaccination as their dosage requires. Kino kiwedde ekya day 1 all using the chemical. We are going to handle the both vaccinations. Then at 1 day old, done. Then at 7 days, the second vaccination, it is in Newcastle, IB and IBD. Why? Why do we frequent this NCD? The reason is nti Newcastle, it is the #1 killer disease which has no cure. In chemical, Nsotoka, known as Newcastle disease, has no chemical medicine that treats Newcastle. Ekyo njagala tubeere very clear. This is done. Now, the administration for day 1, it is injectable. The second vaccination, it is drops. Tutonyeza matondo mukamwa. Stop that business of dropping in the eyes. Why? The eyes have tears. Bw'otonyezaako bw'oti amaziga ne gajja, it will wash it away before doing its work. For that I need it to be very clear. I'm here to train or to teach, not for entertainment, but to train whoever is viewing, regardless of your profession. We have even veterinary officers who doesn't know how to handle the syringe. You start vaccinating when you have already damaged the vaccine. Koko z'abantu ne zifa nga naye nawe ogende owuuba emikono. I'm the veterinary officer. You don't need to lose because of the vaccination handling. Now, at 14 days, we repeat this. Kino njagala nkibagambe. Day 1, it is Malex, Newcastle, IB1, and Gombolo. Now the 7th day, let me be very clear. 7 days, 14 days, 21 days, and 28 days. These are the vaccination days. Day 1, 7 days, 14 days, 21 days, and 28 days. Weekly, but in an advanced way. When we vaccinate at day 1, nga zikyali ku office, at 7 days, gwe zigeme. Are you getting me? Once vaccinated at the office, when they reach at your home, vaccinate at 7 days. 14 days omit it. Vaccinate at 21 days. Why? Because we combine the medicines. Newcastle, IB, Gombolo, bino ebisatu. Wherever vaccinating, make sure you combine them and vaccinate at once. Other than rushing with them, hunting for them, chasing them every week. Because the administration, it is the same in the mouth. And a dropsy. kati oli agenda kugamba nti 7 days go into Newcastle, then 14 days go for Gombolo. Who tells you that in Newcastle, once vaccinated at 7 days, it may not have an outbreak at 14 days? Ebyo abantu bebeetaaga okutegeera. This is the chemical vaccination. At 28 days, you may repeat as done here. Tugambye in the brooding house, we vaccinate 3 times. At 7 days, at 21 days, and 28 days. Lwaki? The more they grow, the more immunity they require. Ekyo tukite. We repeat the vaccination at 6 weeks. That's the vaccination of smallpox.
Viewers of Living Agriculture, this is luigareThe. I welcome you to this channel of Living Agriculture, where you get the knowledge, the skill, and the technical systems. Today, I cordially invite whoever is viewing, even if you are not in the country and you have some people left behind, please, we are organizing a workshop at the farm. And this workshop is scheduled to take place on 8th of June 2024. We are meeting at our offices in the New Tax Park. That's where we shall live as a team or as a group to the farm. The entrance is 50,000. But if you are a living viewer or a subscriber or our family, you will need to pay just 20 is paid by Living Agriculture. Whatever you have been viewing, hatching eggs in a motor tire, hatching in a pot, how do we mix the feeds practically? How do we put charcoal in the feeds? What quantity? How do we make the medicine for toothache, for ulcers, for prostate, for diabetes and pressure? We are going to show everything on that day. I thank you for viewing, but whoever is viewing, share this video. On 8th of June, it is our farm training. We are meeting in the New Tax Park at our offices. That's where we shall depart. The farm is located in Seguku, Katare. This is where we have all our enterprises. I welcome you there, but the registration have to register with the HANA on 0775 107737. Registration 0775 107737. An Airtel subscriber, it is 0741 82 84 05. I repeat, for registration for the workshop, 0741 82 84 05. Make sure that if at all you have one of the diseases I mentioned, on your registration include the treatment you want. Is it diabetes? Is it pressure? Is it prostate? Is it toothache? Or what? Or ulcers? Such that it enables us to come with a medicine. We need treated people. We need live people, such that we can go in farming when we are alive. I'm luigareThe. On 8th of June, it is our farm training at Seguku. The entrance is 50, but for Living Agriculture family, you are going to pay only 30. 20 have been sponsored by Living Agriculture channel. I thank you for viewing. I thank you for liking. we meet on that day.